So I have received orders from the doctor to discontinue the patient's NG2. I have double checked the MR to make sure that I have the right patient, and I've also double checked that the patient doesn't have any head trauma, any issues with his nose, no deviated septum. He's not on any anticoagulants. He does not have any bleeding disorders. And all his labs are within normal limits, so there are no contraindications for the NG tube to be removed. So I have gathered my supplies. I have double checked with the patient already that he has no allergies to latex. So I'm gonna go ahead and see the patient. Hi, good afternoon. How are you doing? I am back. So what we're going to do now is work on your NG2 to be discontinued. So that's good news for you. So what I'm gonna do is ask you once again for your full name and date of birth. John Smith, January 9th, 1984. Thank you, and that matches the MAR. And allergies? No allergies? Okay. So what I'm gonna do now is go ahead and stop the suction. And I'm going to ask you to please remove the gown and blanket. If you need any assistance, I can help you with that. You do? Okay. Alright, so I'm checking, and your stomach does not look distended, so that is good. I'm gonna go ahead and check your bowel sounds now. And I will check all four quadrants, and as I do that, I will use the clock that we have in the patient's room to make sure that I'm also checking his respirations, and they are regular. There is no shortness of breath, no labored breathing. All four quadrants are active, and the patient is breathing at 14 breaths per minute. So I will go ahead and put this down so that we can protect your gown and your bedding. And I'm going to use 30 cc's of air bolus so that I can confirm placement of the NG tube before we discontinue. So I will disconnect it from the suction. Connect my syringe. And I will check for placement. Okay, just make sure that we have it over the stomach. Okay, and I'm gonna ask you to please be quiet so we can hear this real quick. Okay, perfect. It is in the right placement. So now what we're going to do is proceed to discontinue your NG tube. So I will use an alcohol swab to make sure that I don't hurt your nose as I'm trying to take it out. So make sure that I'm peeling the tape carefully, and should not hurt the patient. Okay, so now it's out. Okay, so now I'm going to need you to just bear with me for a minute. And now I'm going to need you to take one deep breath and hold it. And I'm going to try to take out the NG tube as fast as I can, okay? So I need to take a deep breath. Just hold, please don't breathe while I'm doing it. All right? Are you ready? Okay. Deep breath and hold. All right. Okay. Thank you. That's it. Okay. We'll grab everything. And I would make sure if the patient needs any care, oral care or any care for his nose, if he was dry or irritated. So this will go into the biohazard. So that's my biohazard. I take my gloves off and I would clean my hands and I will come back and check for bowel sounds again. And respirations as well, to make sure the patient is not in any distress. So check all 4 quadrants for active bowel sounds again, and as I'm doing that one more time, I am using the clock that is in the patient's room to make sure that I'm checking the bowel sounds at the same time that I'm checking the patient's respiration rate. And once I've done it for a full minute, I will note the respirations, which in this case it's 16 breaths per minute, which is still within normal limits. The patient's bowel sounds are still active. So at this point, I will go ahead and put the patient's gown back and cover him back up. Put his bed in the lowest position and ask the patient if he's comfortable with the head of the bed at that height. If not, then we would arrange it for him, give him his call light, and I will check to see the drainage in the canister, and I have done so, and so I have put my gel to solidify it, and I'm going to go to the nurse station so that I can make my note now. Do you have any questions for me, sir? No? Okay, we have a call by you. If you have any questions, you go ahead and just call us, okay? Thank you. Have a good day. So I will go into the nurse's station and I will make a note in the chart stating that the patient had his NG2 removed per doctor's order. And I will note that the patient was not in any distress and tolerated the procedure well. He had active bowel sounds in all 4 quadrants, and his respirations went from 14 to 16, which is a normal finding. The patient was not in distress due to the NG discontinuation, and his canister had some drainage, so I would note the color of the drainage, the amount of the drainage, and make sure that I note that the patient tolerated the procedure well.